new way of keeping elderly people fit and healthy and out of hospital has shown signs of real success, and it also saves money for the NHS.
Like every other part of the region, the health service in Bedfordshire needs to save money. To do it, they decided on regular check-ups for the elderly. So every week, teams go into old people's homes. The result, A&E attendance is down by a quarter, hospital admissions down by more than a third, and out-of-hours call-outs by GPs down by more than half. The scheme has now been rolled out in all 32 care homes in the district.
They haven't reinvented the wheel. It's simple. Bring the medics to the residents and stop the residents becoming patients.
No, there isn't.
Jack has cancer, Kitty dementia.
Would you mind if I check your blood pressure?
But the single most important thing for their well-being, they say, is simply being together.
We've been married 73 years, 74 years. Of course it's important.
And that means staying out of hospital. These weekly visits mean that any problems are picked up early.
They're in their own environment, it's a lot less stressful. Also, we have the luxury of time.
This is what Jack takes in the morning, you know.
There are, lots of complex health needs. Also, sometimes can be on quite a lot of medications as well, and then you're looking at possible side effects from the medications that they're on in the first place. So there's lots and lots of different issues surrounding their care.
For that reason, the team also includes a pharmacist. Staff too can see the benefits.
There's been one gentleman that the nurses saw the other week who they prescribed antibiotics for a chest infection, and if he hadn't had those antibiotics, I think he definitely would have ended up in hospital.
And in this case, it seems what's good for the patients is also good for the health economy.
We did a pilot study about 18 months ago which showed that we'd managed to reduce hospital admissions by 38% and reduced A&E attendances by 25%. And managed to reduce GP out-of-hours call-outs by an amazing 53%.
And it should help these lovebirds stay in fine fettle for as long as possible. Nikki Jenkins, BBC Look East, Bedford.
Right, OK.
Well, Dr Paul Hassan is a GP in Dunstable and helped devise the service and put it into practice. He's in his surgery now. This must cost a lot of money, let alone the money it saves.
Good evening. I think that in terms of the cost, it's really relatively little money in terms of the amount of money that's saved, and more importantly about the improved quality of care for our patients. It's very easy to talk about reduced numbers of admissions and attendances. What we're really talking about is improved care for our patients who actually don't end up being rushed into hospital in antisocial hours because they've got chest infections or other infections and don't have to call out doctors in the middle of the night. And so really it's about improving the quality of the care that our patients receive.
What about those older people who are not in care homes? They're being left out?
No, this scheme is looking at the people who are the most vulnerable. There are lots of schemes in place across Bedfordshire where we're looking at the vulnerable people who are living on their own or with their partner at home, but and similar actions are taking place. What's happening with the scheme that you've shown on tonight is that they have a team that includes a pharmacist, and this is one of the things that we would like to extend across the rest of Bedfordshire. The other people who we are getting involved with, of course, are the local social services in both Bedford Borough and Central Bedfordshire Council.
Do you think the health service can learn a lesson from here, and maybe this should be extended to the wider community, people who don't go to the doctor, and we might be able to save them going into hospital as well?
Well, there is a scheme across England which is called the NHS Health Checks, and this is available to anybody over the age of 40 can make an appointment to come for a check, and in Bedfordshire we've offered that to 22,000 people this year. And I believe you're showing a film tomorrow evening which shows another team who are taking this out. At the moment most of these checks take place in doctors' surgeries, but this team is going out to find people who find it more difficult to go to their
Dr. Hassan, thank you very much.
I think you'll see it's been very successful.
I'm sorry, I thought you'd finished. Thank you very much for being with us this evening.